Right now in America, about 44 million people are enrolled in the Medicare program. That's about 15% of the U.S. population. And starting next month, Medicare beneficiaries have an opportunity to change their health and prescription drug plans for the coming year.
Now, for some, more options may make for more difficult and confusing choices. But it doesn't have to be that way. We'd like to introduce you to Delaware Insurance Commissioner, this is Trinidad Navarro, and the Director of the Delaware Medicare Assistance Bureau, this is Lakia Turner. Thank you so much for joining us today. It's wonderful having you this afternoon. So let me ask you this. What is the Delaware Medicare Assistance Bureau?
Well, it's really a free program that we provide for folks who are turning 65. And it's funny, my mother-in-law the other day said, "Thank you for the birthday letter." And I said, "I didn't send you a letter." And the truth is, she was turning 65, and it had my signature on it and said, "Happy birthday." And they introduced my mother-in-law to our plan that Ms. Lakia runs. And it's, you know, as far as all the opportunities in our office and of all the programs we offer, the DMAP program is the #1.
Oh, okay, so Medicare has an open enrollment that we mentioned. When is that?
The Medicare open enrollment period runs October 15th through December 7th, and during this time, Medicare beneficiaries can make changes to their health insurance coverage. And we encourage everyone, even if they're happy with their plan, they want to contact our office because this is a time that they can review their coverage, compare it with other options, and make sure that their current coverage meets their needs during the upcoming year.
What kind of changes are you talking about?
So those changes include enrolling in a new Medicare Advantage plan, or enrolling in a standalone prescription drug plan, or switching from original Medicare to a Medicare Advantage plan, or changing from a Medicare Advantage plan to original Medicare with a standalone prescription drug plan, and the coverage will begin January 1.
Okay, so looking at our current or their current Medicare health and drug coverage, how should one review it?
Someone should consider the doctors that they service, make sure that they will continue to work with their plan in the upcoming year. They should also make sure that they can use their preferred pharmacies and know what their costs will be in the upcoming year. They will receive an annual notice of change. They will receive an evidence of coverage document so that they know what the plan will cost in the upcoming year, what the formulary list is, which lists all the medications that they cover, and if they're not happy with that plan, they can make changes during this time.
Is there any assistance for me to help pay for my medication?
Definitely. There is extra help that is available to assist with the cost of medications. It is up to an average of $4,000 a year, and they would call our office to complete the application.
You know, you said a lot of things that may seem confusing, you know, the options, and like we said, they're not confusing, but there is help if anybody needs assistance with all of the enrollment.
Definitely. We will be out in the community between October 15th and December 7th, and we will offer one-on-one counseling in the community. So they can contact our office at 1-800-336-9500 to schedule an appointment and meet us at one of those events.
Do you find a lot of people coming to you for help to try to sort this out, that they feel like they're confused?
Well, that was a lot, wasn't it?
Yeah, it really was. Yeah.
And the truth is, she's the expert. And we get correspondence from people all the time who interact with our office. And this program, you know, what people don't know is it's free. Mm-hmm. They can sit down one-on-one with experts like Lakia and her staff, and we help people each and every day. It is complicated, but not for her. Yeah. And, she truly is the expert.
Yeah. Mr. Navarro, thank you.
My pleasure.
Very much.
Thank you so much.
Thank you.
Lakia.